37 cents. That's what one serving costs. One berry available year-round at any grocery store in America. And a published clinical study showed it improved insulin sensitivity by 22% in 12 weeks. The berry is the blueberry. But the blueberry is only the beginning of today's story, because sitting 2 rows over from the blueberries in the produce section, almost always overlooked, are 2 more fruits 90% of people managing blood sugar walk past without ever picking up. One of them has more vitamin C than an orange by weight. The other builds fiber like a brick wall around the sugar in your gut. And a 67-year-old woman named Margaret dropped her A1C from 8.2 to 5.9 in 4 months by adding exactly these 3 fruits in the exact form I will show you today. Her endocrinologist called her case unusual because her medication did not change once. Her plate did. Before I name a single fruit, 2 quick things, and they matter more than you think. If you are over 60 and watching your blood sugar numbers, subscribe. This channel exists to give you the explanation a 12-minute office visit never has time for. Then leave one word in the comments, the fruit you reach for most days of the week. I read every comment, and they tell me what to cover next. That's it. Now let's get into it. So let me explain why most of the advice out there about fruit and blood sugar is flat wrong. Because it treats fruit like one thing, like the same thing in different colored wrappers. It is not. Some fruits raise blood sugar. Some fruits almost ignore your blood sugar. And a very small group of fruits do something almost no one talks about. They actively lower it. The difference comes down to 3 things working inside your body right now. The amount of fiber in the fruit, the type of sugar it carries, and one more thing almost no one talks about. The specific plant pigments locked inside the skin and the flesh. The pigments are the real secret, because they are the part of the fruit that talks directly to your insulin receptors. Here is how this works inside your body. When you eat a piece of fruit, the sugar in it, mostly fructose, goes to your liver. In small amounts with the fiber still intact around it, your liver can process it cleanly. No big spike, no crash. The sugar trickles out of the fiber slowly like water seeping through soil. But a piece of fruit without enough fiber to slow it down sends that fructose into your liver like a fire hose. Your liver converts it to fat. That fat builds up around the organ, and your liver starts ignoring insulin, that is hepatic insulin resistance. Once that door opens, your fasting blood sugar climbs. Even on mornings when you have not eaten a thing, even while you sleep. The fruits that work against this are the fruits that carry enough fiber to slow everything down, and enough pigment to send a real signal to your cells that says, respond to insulin better. That is the group we are talking about today, exactly 3 of them. And they all pull this off in slightly different ways, so let me walk you through them. The least powerful first, the most powerful last. And the most important thing in between is what you do with the fruit once it is in your hand, because there is a wrong way to eat every one of them. And the wrong way cancels out roughly 60 to 70% of the benefit without you feeling a thing. Number 3, guava. Guava is the fruit 90% of my patients have never bought in their life, which is a shame. Because of the common fruits available in any American grocery store, guava has the lowest glycemic index of them all, around 12 to 24 depending on ripeness. For comparison, a banana sits around 50, an apple around 36, a pear around 38. Guava is in a different universe. Banana, guava, about the same serving weight, completely different reaction in your blood, and here is why. Guava carries roughly 9 grams of fiber in a single medium fruit. That is more fiber than a cup of oatmeal, and almost 4 times what you get from an apple of the same size. That fiber wraps around the sugar in the fruit the way a glove wraps around a hand. Your body cannot reach the sugar quickly, so your blood has to take its time. No spike, no crash. But guava also brings a heavy dose of vitamin C, far more than an orange by weight, plus a set of carotenoids and polyphenols that have been tied to better fasting glucose numbers in published research. And the skin is safe to eat. In fact, the skin has more pigment, more fiber, and more of the active compounds than the flesh underneath it. Here is the wrong way most people mess up guava before they ever taste it. They peel it. The pink flesh looks too delicate to leave the skin on, so they strip it away. And that is exactly where a large share of the fiber goes, along with most of the polyphenols. So they end up eating the sugary interior with the protective glove ripped off. Some people scoop it raw into smoothies. That's worse. Blending destroys the structure of the fiber entirely. You have made guava juice, and now you are flooding your liver with exactly the fructose load you were trying to avoid. The right move: cut the guava in half, scoop with a spoon, skin on, do not peel it, do not blend it. Half a guava with the skin still there in the afternoon with a small handful of almonds. The healthy fat slows everything further. Your blood sugar will barely register the meal. Number 2, the kiwi. The kiwi looks like a small vegetable and most people eat it like one. They peel it, slice it, and never realize what they have thrown away. Because the fuzzy skin on the outside of a kiwi is one of the most underused tools in your kitchen for managing blood sugar. The skin carries an enormous amount of fiber and a dense layer of polyphenols that you simply do not get by stripping it off. A peeled kiwi carries about 2 5 grams of fiber. The same kiwi with the skin on carries around 4.5 grams, that is nearly double, and the polyphenol count climbs with it. New Zealand researchers published findings showing that eating 2 whole kiwis a day over an 8-week period produced measurable improvements in fasting blood glucose in adults with prediabetes. Once again, that is a fruit you can buy for under $1 at any grocery store, doing what some early diabetes medications do. With side effects that are nothing but better digestion and more vitamin C than 4 lemons stacked on top of each other. Here is the wrong way that ruins this for almost everyone. Most people peel the kiwi with a vegetable peeler and throw the brown fuzzy skin straight into the trash. That skin is the working part. That fuzzy outer layer is loaded with the polyphenols and most of the extra fiber. They throw it away and eat only the bright green center inside, then wonder why nothing changed on their meter. Some people also blend kiwis into morning smoothies along with banana, mango, and a splash of juice. Blending shreds the fiber into nothing. So even if you remembered to keep the skin on, you have now turned all of it into something closer to juice. The sugar hits your liver almost as fast as soda, the right move. Wash the kiwi well under running water. Rub the fuzz off with your thumb or a soft cloth, then bite into it whole, skin and all. If the fuzzy texture is too much, slice it into thin coins and leave the skin on every single coin. 2 kiwis a day with the skin on, eaten whole, never blended. That is the entire instruction. Number 1, the blueberry. The 37-cent berry I opened this video with. And the reason it earns the top spot is the specific pigment locked inside its skin. That pigment is called anthocyanin. It is the deep purple-blue color that stains your fingers when you crush a blueberry too hard, and anthocyanin does something no other fruit pigment does, at the level blueberries carry it. It speaks directly to your insulin receptors. It improves how your cells hear the insulin signal. So sugar leaves your bloodstream and gets pulled into your cells where it belongs, instead of pooling in your blood where it causes damage. A published clinical study found measurable improvement in insulin sensitivity in roughly 12 weeks from blueberry consumption alone. The participants were eating only about a cup a day, and they were not doing anything else. No new exercise program, no new medication, just blueberries. Their cells started responding to insulin again. And that is the foundation of everything else on this list. Because once your cells listen to insulin again, the rest of your numbers start to follow. Here is the wrong way that ruins blueberries for almost everyone. Most people destroy the benefit before it ever reaches their blood. They toss blueberries into a blender with banana and yogurt and almond milk and call it a healthy smoothie. That combination shreds the blueberries' fiber into nothing. You are drinking the sugar with the medicine poured down the sink. They bake them into muffins, white flour, white sugar, a handful of blueberries on top. The flour inverts to glucose almost instantly, and the muffin becomes a vehicle for a glucose spike, with a few berries as decoration. They sprinkle a handful on top of a bowl of sweetened cereal. Same problem. The cereal and the milk and the added sugar are spiking your blood long before the berries can offer any countersignal. You are eating the bottle and pouring the medicine down the sink, exactly like I described earlier. The right move is almost insultingly simple. Half a cup of whole blueberries, fresh or frozen. It makes no practical difference to the anthocyanin content. Mixed into plain Greek yogurt, or eaten next to a small handful of walnuts. The protein and the fat slow the absorption of everything. The fiber in the berries keeps the sugar inside a tight capsule. The anthocyanins do their work in the bloodstream. The whole berry arrives at your gut, and your gut has to break it down one piece at a time. Whole, not blended, not baked, not buried in cereal, not turned into juice. Let me tell you about Margaret. She was 67 when she came to see me, 8 years into a type 2 diabetes diagnosis and already on metformin. Her A1C was sitting at 8.2, which is the range where the conversation turns to adding a second medication, sometimes insulin. Margaret did not want that. Her sister had been on insulin for 6 years. Margaret watched what hers went through. She did not want to go there. So I walked her through what I just walked you through. Not exotic supplements, not a strict fasting protocol, not the cinnamon cure the internet keeps reposting without evidence. 3 fruits, eaten the right way, added to what she was already doing, with no medication change. Here is what Margaret actually did every single day for 4 months. She added half a guava with the skin on in the afternoon, eaten with a small handful of almonds. She ate 2 washed whole kiwis, skin on, not peeled, as an evening snack. And she put half a cup of whole blueberries into plain Greek yogurt every morning. She did not give up her metformin. She did not change anything else about her diet. She did not start running. She did not join a gym. 3 fruits, eaten whole, with the fiber and the skin still in place, spread across 3 different points in her day so her blood sugar never had to handle them all at once. 4 months later, her A1C read 5.9. Her endocrinologist asked her what had changed. She said 3 fruits. He wrote them down. Because her medication was the same, her starting point was the same. The only thing that moved was what was on her plate at 3 separate moments of her day. So here is exactly what to do starting tonight, before this becomes one more video you watched and forgot. 1. Go to the produce section this week and buy all 3 of these fruits: blueberries, kiwis, guava, fresh or frozen. Keep them where you will actually see them. A bowl on the counter, not buried in the crisper drawer where they rot quietly and you forget they exist. If guava is hard to find fresh where you live, frozen works and most international grocery stores carry it year-round. 2. Cut the kiwi in half, then slice into thin coins. Leave the skin on every coin. Do not peel it. Wash the skin thoroughly first. Rub the fuzz off under running water. Eat it whole. 2 kiwis a day, afternoon or evening, when you would normally reach for crackers, chips, or whatever else is sitting in the pantry waiting for you. 3. Half a guava, skin on. Cut it in half. Scoop with a spoon. Do not peel it. Do not blend it. Eat it in the afternoon with a small handful of almonds. The healthy fats in the almonds slow everything down even further. If the texture bothers you, slice thin wedges with the skin still attached. That works just as well. 4. Half a cup of whole blueberries every single morning. Not blended into a smoothie, not baked into muffins, not sprinkled on cereal, not stirred into pancake batter. Whole, fresh or frozen, mixed into plain Greek yogurt, or eaten next to a small handful of walnuts. The protein and the fat matter. They are not decoration. They are the brake that keeps the sugar steady. 5. And this one is the part most people skip. Pay attention to the wrong way mistakes I named for each fruit. If you juice any of these fruits, you are throwing out the fiber and concentrating the sugar. If you peel them, you are throwing out polyphenols, and often a big chunk of fiber. If you blend them, you are doing both at the same time. The wrong way looks healthy. It looks like a smoothie on a glass jar with a label of wellness. It is not. It is a sugar delivery system with the medicine poured out. The form of the fruit on the plate is the difference between a number that drops and a number that climbs. 6. And this is the one that is not optional if you take medications. None of the 3 fruits on this list interferes significantly with common diabetes, cholesterol, or blood pressure drugs. But if you ever add any new food in significant amounts and you take prescription medication, the safe move is one phone call to your pharmacist. It takes 3 minutes, and never stop a medication on your own because of something you saw online, including from me. The fruit is the easy part. The drug interaction is the part that puts people in the hospital. Here is the piece that should stay with you. Margaret's medication did not change once during those 4 months. The fruit did the work because she ate it whole, with the fiber and the pigments intact, and because she spread it across the day instead of dumping it all into one morning smoothie. That is what separates a fruit that lowers your blood sugar from a fruit that spikes it. Not the fruit itself, not the name on the bag, the form it arrives in, and what is still attached to it when you chew it. That brings us to the next video. The 3 morning drinks most people over 60 reach for every single day that quietly raise fasting blood sugar. One of them is probably sitting in your kitchen right now, and the 2 that genuinely help. If you want your number to move the way Margaret's did, that is where to go next.